Hi, everyone. I'm Steve. I'm here with Dr. Nario for our weekly little conversation. Thanks for being here, Doc.
Hi, Steve. Thank you for having me again. Always a pleasure.
All right, we're going to talk about a really great topic, vitamin C. And vitamin C is amazing. There's lots of ways to take it. I'm going to ask you some of the things that it does, some of the ways to take it, and you really want to talk about the different types of vitamin C because there's more than one type. So, before we get into that, if you guys are interested in interviews with doctors, nutritionists, personal trainers, subscribe to the channel. And if you're interested in our weight loss program, use the QR code on the screen or the link in the description. Vitamin C. How you take it depends on how much you can take, right?
That is correct. It's all about tolerability. This is why we created different forms of it, just because there's so many intolerances with just the basic vitamin C that's out there. But that is correct.
Can you build up if you're taking like an oral capsule or something? Can you build up to where your body tolerates more?
So that's a good question, Steve. The thing here is when you talk about vitamin C, there's only so much that you can give. So vitamin C is what we call ascorbic acid. So when you talk about ascorbic acid, this is the purest of pures when you talk about vitamin C. That's why there's a limit for vitamin C, only ascorbic acid, because it's a very known gastric irritant. There's only so much that your stomach can take. And this is the pure vitamin C molecule. It's very acidic. That's the reason why it's causing all of these GI problems. Like pain in the abdominal area after taking it. And that's why from this complaints of patients, the buffered forms were created in order for the problem to be removed off the list and be taking vitamin C harm-free and even freely.
So, there's multiple types, and I know that you do vitamin C IVs there, which is a 50,000 grams, right?
Milligram.
Milligrams, 50,000
Okay.
milligrams, which would be what, 5 grams of vitamin C right into your vein. And what type of vitamin C is that? Is that what you just mentioned?
Right. So the IV form is the better one to give is buffered. So this is the most common buffer that you will hear. The safest one that you will hear would be sodium ascorbate. There could be calcium ascorbate, magnesium ascorbate, but sodium ascorbate is the most common one, and this is the more neutral or buffered form wherein the pH is very safe. But when it goes into your veins, it doesn't hurt. But there's also an infusion using pure ascorbic acid, which is this is now the ones that I was mentioning to you. That's irritating because its pH is very acidic. So with the preference of what to use through IV, it's probably the buffered one or sodium, so that it would be a smooth IV infusion.
Okay, so let's talk first about all the different types of vitamin C, and then, if you will, let's get into some of the benefits and some of the uses of it. But first, tell us about the different types, because you can take an oral capsule. There's lots of ways to take it.
All right.
But first, like I even have a vitamin C that comes from real food, so I don't know what type of vitamin C that is actually called, but it's some of these companies take the vitamin C from food
Hmm.
and they make a capsule out of it.
Right. So everything that you're hearing about vitamin C, it's basically ascorbic acid. So meaning may it be from food that you're getting it, maybe from capsules that you're getting it from, or even liquid. All of these are the baselines are usually just plain vitamin C, which is ascorbic acid. Again, with the word ascorbic acid, it's always affiliated with the good things that vitamin C brings to the table: collagen creation, immune defense, adrenal health, antioxidant protection. So huge for anyone who's undergoing physical stress. And that's why the only problem why now it evolved into something, as I mentioned to you, there were a lot of takers orally of vitamin C, and they were having diarrhea, acid reflux, gastric upset. Thus, the creation of a buffered or a safer form of vitamin C, which is now what we call the mineral vitamin C. So when you mentioned about the different types, so it's really just buffered vitamin C. Under the umbrella of buffered, now you will hear calcium, sodium, magnesium ascorbate. And this is just vitamin C adding a specific salt to it so that it won't be irritating to the gut lining, and it's gentle even for. So here's the one thing: the mouth. Vitamin C, pure, can actually be irritating to the mouth or the dental area. So ruined teeth, right? It could be even the gums are going to be inflamed. If you're using pure ascorbic acid, you should probably change into a buffered form, especially if it's something that you're drinking, if it's a liquid, because it's going to get your gums exposed. And that's why, again, the difference would be just gentle type of form of vitamin C versus a little irritating, which is the original ascorbic acid that's out in the market.
Okay, what about liposomal?
Right. So these are now what we call delivery forms of vitamin C. So with this one, liposomal is something that the word itself, it's being placed around a fatty carrier so that it can really be absorbed faster by your intestinal lining. So this one, it's usually just a mode of carrier. It's not a type of vitamin C. It's more of the mode of delivery of this medicine. So that's
Right, it's a
also another
liquid.
good one. That it's a liquid most of the time. That's correct, or sometimes even a cream. There are, so you have to remember vitamin C is being used in the dermatological world to help skin wrinkles. So it's an antioxidant, and that's why it lessens skin wrinkles. And they also use liposomal facial creams, for example, for wrinkles, for scars, and other dermatological needs.
Okay, so what type of vitamin C do you use with your patients, maybe with your athletes? So what type do you use and why? Yeah, what for?
Right. The majority of studies out there are usually just in the form of ascorbic acid, plain ascorbic acid. But the ones that I use with my patients, as I mentioned to you, like for example, IV therapies, we want it to be safe. We want it to be relaxed in terms of the experience. Sodium ascorbate. That's the one that actually is the more useful in our clinical practice. And again, you mentioned about our athletes. Why we give a good dose of this, especially in IV form, is because training training stress depletes a lot of vitamin C, especially during high intensity and endurance workouts. And also, vitamin C helps with collagen formation, wear and tear of the joints and ligaments of our athletes. They need to be addressed. Immune resilience, especially after intense training. So these are our professional athletes that are all just training like every day, 24/7, and imagine 24/7 training, cortisol goes high. And this is also a good adrenal support under this extreme physical stress that they're going through. So again, with IV therapies, it's just really there's a lot of people thinking that vitamin C just for colds, they assume that it's getting enough from food or oral supplements. But the truth is, when your body is under intense physical stress from hard training and injury or poor sleep, even your vitamin C demand goes way up, and oral absorption has its limits. And in the form of sodium ascorbate through IV, 10, 25, 50 grams, we can safely give this into the bloodstream. And again, and with the serious beneficial effects, such as enhancing the mitochondria, fast muscle recovery, reduce inflammation, and even better sleep post training. So there's a study. Okay, this is something that I will quote, that the Annals of Intensive Care show that IV vitamin C reduced oxidative stress and supported adrenal function in critical stressed patients. Now imagine that for athletes or clients even having burnout, surgery, or even overtraining. So it's not something you need weekly forever, but it's a powerful tool when your system is taxed and when you're hitting a training plateau, bouncing back from illness or prepping for a competition. So a maintenance would be even good as a protocol.
What else do you use the IV vitamin C for there in the clinic, like with other patients when they have different issues? What are some of the other reasons why you would use it?
So a good one where a lot of our patients, our clients use it for cancer. So when you talk about cancer, high dose vitamin C, turns into what we call hydrogen peroxide molecules. And these hydrogen peroxide molecules are toxic to the cancer cell. So when they convert, it's just an overload of oxygen. Now, you have to remember, cancer doesn't like oxygen. It's a cell that lives in an area where oxygen is very low because that's where they thrive. They like the acidity. They like the bad environment for them to grow faster and better. Another one would be repair. We have a lot of patients who goes through post surgery, right? You have an opening in your, let's say, your abdomen. You want that to heal faster and better, even dental procedures. So vitamin C, just overall, is actually something that you could actually use it on anything. But these are the common cases that we actually see here in the practice.
What else would the peroxide benefit when, because I know you've told me at that high dose, it converts to peroxide. What other benefits would that give you?
So when you actually look at peroxide, this is something that you use it for skin, right? To clean, prevent infection. Same thing for the body. So when we use it, we like an example, like people are now getting all these respiratory infections from the virus. So when it gets introduced to your system, it has this ability, antiviral, antimicrobial ability to actually help that immune system get rid of these infections. So that's another one that hydrogen peroxide is very useful for. So, but basically it's an oxidative therapy, increases the oxygen levels of your system so that the body can get more, and also for the microbes that are in your system that does not want it, they will be delivered for them to get eradicated.
So you also use oral versions of vitamin C, right?
Yes, we do. So that's the most
Yeah, how
common.
would you use that?
So that's the most common form when you talk about vitamin C, because you don't always have access to IV therapies when you're at home. A lot of my patients, majority of my patients are using it. So that's why the thing that I always advise them would be for the use. I mean, so here are the dosing for everyday immune support. Okay, I'm talking about sodium ascorbate, which is also the best one, 500 to 1,000 milligrams once or twice daily. During illness or high stress, 2,000 milligrams daily in divided doses. So this is just during illness. This is not your maintenance dose. For our athletes, pre-post workout for antioxidant support, 1,000 milligrams before or after training. And again, this is it can be in powder, it can be in capsules, and people are kind of cautious about, oh my god, it has sodium, it's going to raise my blood pressure up. Not really. The content of 1,000 milligrams of sodium ascorbate, it's equals to 111 milligrams of sodium. That's less than what's in half a slice of bread. So unless you're salt sensitive or in a strict low sodium diet, it's not usually a concern, especially for athletes who just lose sodium in their sweat a lot. So that's why, again, make sure you consult your doctor about the specific dose that you have, but that's just a standard guide for everybody.
Okay. Yeah, there's so many uses of vitamin C, and it's interesting that you bring it into the athletic focus or arena where it can really benefit people training. And of course, we all know when we get a cold or whatever, that's when we can take the 2,000 a day, split up throughout the day.
Right. So that kind of got its claim to fame when COVID hit too. So that's where kind of the stage got laid for. I mean, it was already popular even before, but COVID kind of made it a big hit.
Okay, so what else would you say about vitamin C? Maybe something I didn't ask, or about the oral form or the different types, or what did I miss?
Well, with as I mentioned to you, ascorbic acid is a standard form. It's acidic. It can irritate stomach in higher doses, so be cautious of that. Sodium ascorbate, it's buffered, gentler, ideal for the immune system recovery, and even you can do high doses of it, not getting into that trouble of irritating the stomach. But for fitness-focused individuals, sodium ascorbate can be a smarter choice when stress, injury, or illness hits. May it be oral, may it be especially IV. So we have a lot of athletes here doing that because they have seen the importance and changes in their performance after using sodium ascorbate or ascorbic acid. So either way, we have different ways on how to deliver it.
Okay, so everyone, Dr. Nario is at Biointegrative Health Center if you're curious about that in Reno, Nevada, and you can check them out online, Biointegrative Health Center in Reno, Nevada, and you can see all the different treatments they do and see the things that they do. So, I'm going to give you one more bite at the apple, Doc. Is there anything else you'd say about vitamin C?
Well, the thing here is, again, don't be afraid of vitamin C. This is something that's been out in the market and have been proven to have so many conditions. It's just that we need to get educated about it a little bit more, especially if, yeah, you don't want to be getting diarrhea, you don't want to get all of these GI effects, and you just want to tolerate it. There are options. So the options would be are these buffered Cs. So that's why this is something that you probably have to look into. And this is not well known for people out there, but there's specific use. Like if you want magnesium with your vitamin C, like magnesium ascorbate, you can get the benefits of magnesium along with the benefits of vitamin C. Same for sodium ascorbate. You get the benefits of sodium and you get the benefits of vitamin C. That's the only reason why a buffered, I guess, vitamin C is made. You want to add a salt there, so in terms of what type of health goals you want to achieve for the patient.
All right. Thanks, Dr. Nario. I mean, vitamin C is a great substance. As always, thanks for being with us.
Well, thank you, Steve, for having me. As we all know, that knowledge is power. And thank you for letting me provide you with age on longevity and health maintenance, which I call the biological edge or the bio edge.